Hi, this is Jonathan from Fitness for Freedom. Today we're going to talk a little bit about heart disease. So heart disease is the #1 killer in North America, which is unfortunate because it is also the most preventable disease that you can have. Now there's heart disease. Heart disease is any disease that affects the heart, but today we're going to talk about atherosclerosis because that's the most common one. So for this demonstration, we have our aorta right here, which is attached to our coronary artery that feeds our heart muscle right here. So as you can see, it's a nice flexible tube. It's very clear. There's no impediments in it, so there's no fat in it yet. And we have our blood, and we have our fat right here, which is just bacon fat. But in this liquid form, almost all fat looks pretty much the same. When it's hardened, it looks like the pot roast the day after Thanksgiving, when your mom has just put it in the fridge and you pull it out because you're hungry the next day and you want turkey, but then you see that there's this like gross fat all around the outside on the bottom of the pot. So that's what it looks like when it's hard. So that whitish, yellowish hard stuff gets stuck on the inside of this artery, which impedes the blood flow and causes either an angina or a heart attack. So right now, we're just going to take a little look. So we've got our blood here, and we're just going to pump it through our artery, and look at that, nice clean flow, no problem at all through the clean artery. And what usually happens now is this fat, I don't have enough hands, but the fat would normally be mixed in with the blood, and it's going to go through here as well. And as you can see, it's got a higher viscosity, so it's thicker than the blood, and it's sticking on the inside of the arterial wall. So we're going to come back in a couple of years, and we're going to see how we're doing. So here we are, back again a few years later, and you can see that there's a little bit of plaque buildup on the inside there, and yeah, it's kind of gross looking. It smells pretty good, but it looks really gross. But what fat doesn't smell good? And so we've got our heart here, and we're just going to pour it in, and you can see that there's actually a little bit of blood flow. The blood flow is impeded a little bit, but not a lot. And that's actually pretty dangerous. And what's dangerous about that is that we have this plaque. You can see it built up on the inside, but we have no idea that there's anything wrong as a person. We think that everything's just fine and dandy, and that we're rock stars, and nothing bad's ever going to ever happen to us. But as you can see, that if I pour, so we're continuing to live, and we're just going to pour a little more fat in, just like that. And as you can see, it's still dripping in there. And yeah, so we're going to come back again in a few more years, and we're going to see what's going to happen. So here we are, back again, just a few years later. And as you can see, there's a little bit more fat in our artery this time, which is never a good thing. It's actually not as bendable as it was either, so it's losing its elasticity a little bit, which is unfortunate because having tubes that expand and contract easily is very important for blood flow purposes, especially when we're trying to exert ourselves or do exercise or something like that. So let's just cut to the chase here and see what's going to happen. As you can see, it's definitely still going through a little bit more slowly, and you guys couldn't see that very well. But I could see here what was actually happening is that some of the fat was actually being pushed out with it. So if this is, say, the good part of the artery. If there was more artery here, a little piece could have broken off, and we could have had a heart attack, which would be really unfortunate. But it's your lucky day, so we're going to continue to live, which means we get to eat more fat. So I'm just going to pour it down here. Fatty McFatterson. Oh, geez. So it took quite a while to actually get out there. So that's good. Well, it's not good, but for the demonstration, it's good. We're going to come back in a few years again, and let's see how it holds up. So here we are, back again, and as you can see, we've got even more fat in our coronary artery here, and it's actually getting really stiff now. It's actually it holds the shape even when I bend it here. So I think no surprises. Let's just fill it up and see what happens. We know that things aren't looking very good here. Oh, saw that coming. So we'll call this heart attack number 1. So we better get to our dude to a hospital right away. Luckily, I have the utensils here, and right here I've got my little angioplasty surgical utensil. I don't actually know what it's called. You can ask a heart surgeon, and they'll be able to tell you right away. So what they do is they go up in through an incision in your body, and they're going to find their way in to your heart, and they're going to poke a hole through. They're going to clear it up. As you can see that we can see where the clog is. Thank goodness. And oh, we're not long enough here. Boom. We have the technology to fix that, and we gotta slide it all the way down here. We're gonna push through. See, that's pretty thick. We're gonna push through the clog, and we're gonna blow up a little balloon on the. Oh my goodness, it is so thick. I really wanted to do one more stage of these demonstrations, but this is so thick we might not make it. This is what the doctor does. He's got to try to make it through your little plaque buildup. Probably you're a candidate for bypass surgery if it's this thick, and we're just gonna have to ram it in there as hard as we can. Maybe, hopefully, you've got a straight artery when the doctor's trying to do yours. So let's pull that out. Let's give that a try. Oh, look at that. That's disgusting. Good. We're going to give it a try though. Let's see what happens. See if our surgery was successful. Angioplasty. We'll pretend we put a stent in. So a stent is like a little fence-like thing. Oh, there you go. So as you can see, it's making its way through. So I would describe this as an unsuccessful stent surgery because it's such a small amount that we can't even get the blood through. So I'm gonna play a trick here. I don't know if you can actually do this surgically or not. We're gonna go back up the other way. I know that if I was a plumber, this is how I would want to do it. And actually, that's what a heart surgeon is a really sophisticated plumber. Oh, we're dripping blood everywhere. It's a good job this is not a good basement. Nice carpet. My wife would be furious right now. Anyways. So I think you get the point. Unfortunately, if this was your artery, if they didn't get you in time, then you would, for bypass surgery, it was too thick for the stent device to get through. You'd need a bypass. So hopefully you're not one of those people. And if you'd like some more information about exercise intensities, or you're having trouble getting motivated, I don't know, if this doesn't motivate you, I don't know what will. I know it motivates me every day to do at least something a little bit active. You can go to fitnessforfreedom.com, and we can set you up with some motivational tools to make it easy for you to exercise. Yeah, So good luck.